Hello friends, I'm Rishmeet and you are watching Patient Education Series on Cancer. Friends, cancer changes the life of its patients, but the sufferings get even more painful when it strikes at the individuality of its patients. We are talking about breast cancer, which is an emerging health problem in women. Experts project that the number of breast cancer cases in India is about 1 lakh women each year, and in future there will be approximately 250,000 new cases in India. The main cause of this situation is ignorance and lack of knowledge. Women are unaware of the severity of breast cancer. That's why most cases remain undetected. Today, we will try to focus on the various aspects of breast cancer with the help of our renowned expert, Dr. V.P. Gangadharan. Dr. V.P. Gangadharan is a world-renowned oncologist, a fellowship holder from NCI and WHO. He has pioneered the idea of blood stem transplantation in Kerala and is the founder of the first medical oncology department in Trivandrum. He is the father of Cochin Cancer Society, a charitable institution that helps patients physically, mentally and financially. It is his pledge that no patient should go back without treatment due to lack of money. Dedicated to serve the humanity, he has launched the campaign to eradicate cancer completely and has been educating the people about prevention, early detection and treatment of cancer. An author of over 35 publications, he has received several awards till date and has been felicitated with Indira Gandhi Puraskar and JCI India Award for Outstanding Contribution in the field of medicine. It's a pleasure to have Dr. V.P. Gangadharan with us today. Let's welcome him.
Thank you for having me.
Doctor, breast cancer has become one of the leading causes of cancer-related mortality among women. So let me begin by asking, please help us understand what is breast cancer?
Breast cancer is a cancer developing in the breast tissue in the patient. What exactly happens is they can start usually as a ductal carcinoma and then reach the breast tissue as a whole. So it's actually a cancer developing in the breast tissue of the females or males, of course.
So what are the risk factors for developing breast cancer?
The highest risk factor is that somebody is a female, because that's the highest risk factor. Then over the age of 40, some people even put it lower down now, over the age of 30, 35 years. Then of course you got a small chance for heredity which operates for 5 to 10% chance. Having no children or postponing the first pregnancy beyond the age of 30 years, not breastfeeding the children, because that's again one of the highest risk factors which has been described. Then overuse or abuse of oral contraceptives. Of course, the next is a weight gain. That means you are going to eat more and more of a fat, high-calorie diet without any exercise. And of course, I think for the next generation, it's going to be alcoholism also in India.
So doctor, let me ask you, how many Indian women get diagnosed with breast cancer every year?
The incidence of breast cancer in India is 94 per 1 lakh population. That's the present incidence of breast cancer in India.
Doctor, what are the signs and symptoms of breast cancer?
For breast cancer, I think the following are the warning signs which you have to look for. Painless, slowly growing lumps in the breast, or painless, slowly growing ulcers in the breast. Nipple retraction, or a discharge per nipple, especially if it's going to be a bloody discharge. Or any pre-existing mole, if it's rapidly increasing in size, or if it becomes itchy, or if there is a bleeding from that mole, you have to suspect the possibility. Or reddish patches, painless reddish patches in the breast, slowly increasing in size, think of the possibility of a breast cancer. Or a small dimpling happening in the skin, or skin changes happening, I think again of the possibility of a breast cancer. Very clearly you have to remember that none of these are going to be a definite finding for a breast cancer. The only advice I'm going to give you is, if any of these symptoms are there or signs are there, go get examined and rule out the possibility of a breast cancer.
Is it possible for men to develop breast cancer?
Yes, men can, but the probability is very, 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 very rare. That's all. I think men can also develop breast cancer.
What are the recommendations for early detection in breast cancer?
One major advantage for cancers in females in India are breast cancer and cervical cancer both can be detected early. That means that they are called as screenable cancers. That means you can go for a screening program and detect these cancers early. The screening program for a breast cancer is, above the age of 40 years, go for an annual mammogram. Mammogram is a specialized X-ray which is used specifically to look for growths happening in the breast. The second is, go for an annual breast examination by a clinician. Left to me, I'll say that much more important is, everybody should practice a breast self-examination which has to be done every month. And the caption given for breast self-examination is, breast self-examination requires a very costly, very sophisticated equipment, and that equipment is your own hand. Between the ages of 25 to 40 years, the recommendation is go for monthly breast self-examination, as well as go for a clinical examination by a qualified doctor to be done once in 3 years. A sonomammogram, that means an ultrasound of the breast, can also be added to the list. And the best time for doing the examination is when you are taking a bath, because when you have applied the soap, even small lumps can be felt easily. The special message which I am going to tell you is that never palpate your breast with your fingertips. If you are going to palpate the breast with your fingertips, I think each female is going to think that she has got at least 100 cancers in the breast. So you have to always palpate with the inner aspect of your palm. At the same time, the breast is not only in the front of the chest, but it extends to the axilla also. So palpate the breast in the front as well as palpate the axilla also for completion.
How's the diagnosis done for identifying breast cancer?
The diagnosis of breast cancer is done by taking a fine needle aspiration or a biopsy of the suspected area. That means the affected or suspected area, the cells are drawn by using a syringe and needle or by doing a biopsy and examine and see whether these cells has got a convent girl appearance or a college girl appearance, and then identify whether it's having a cancer or non-cancerous.
What are the treatment options for breast cancer?
The treatment of breast cancer is by a surgeon, by a radiation oncologist, and a medical oncologist. That means it's actually a comprehensive treatment approach which incorporates all these three specialists: surgeon, radiation oncologist, and a medical oncologist. The treatment options are going to be surgery, radiation, chemotherapy, and hormone therapy, and the recent advances like targeted therapies. They all come in the treatment protocol of a breast cancer.
So, what are the recent advancements in the treatment of breast cancer?
The advances in treatment in breast cancer has occurred in all the fields. When you come to surgery, previously the treatment option was to go for a radical mastectomy. That means you remove the breast, you remove the ribs, and for fun we even used to say that you go on removing and finally even you may remove the part of the couch where the patient is lying down. So that was the treatment concept at that point of time. Whereas now, if somebody does that, we'll say that he is not an oncologist. Because if there's any chance, the present concept is you have to try to preserve the breast. That means a conservation, a breast conservation is the treatment, the present treatment of choice is the present, I'll put as is the present art of treatment in surgery. The next step in the treatment of breast cancer is, I think it's a heterogeneous disease. That means breast cancer as such is not a single disease. Each disease or each patient is identified as having a separate type of disease, and that has come to the amount of labeling them as a tailored therapy. That means each disease has to be analyzed in terms of various factors, including the receptors and all, and then try to identify what is going to be a line of treatment to go into the factors called as a tailored therapy in breast cancer.
Can women go back to their normal lives after being diagnosed and treated for breast cancer?
The answer is very simple. Your aim of treatment is to bring them back to their normal life, which is possible. But one thing you have to remember is this is possible to the maximum extent when you have got an early stage disease, and that is the relevance of going for an early detection. So if detected early, they are got a very, very good chance or almost 100% chance of going back to their normal life. So normal life, both physically, mentally, socially and sexually, that is the hallmark of a cure in breast cancer.
What can women do to prevent breast cancer?
Low fat, low calorie diet, good exercise and a high residue or a high fiber diet, which helps a lot for them. The much more important is, I think they should be very careful when they go for, I will put as an abuse of hormones, which is again something which they have to be very careful. Smoking, alcohol, just like in males, I think again something which has to be modified. A modification of the diet, which I already covered up, I think that is something very important again in the females for the prevention of a cancer.
Friends, breast cancer is curable, but the only thing to curb this disease is self-screening, timely checkups, and above all, awareness. Thank you, doctor, for your insights on breast cancer.
Thank you for having me.
So friends, we hope that our initiative would be useful for you to be aware of this menace called breast cancer. Our effort has been to educate you regarding this so that you could be free of this disease or at least get timely help. In case you have any queries, please contact us. Our address is Department of Medical Oncology, Lakeshore Hospital, NH 47 Bypass, Maradu, Nettur Post Office, Kochi, Kerala 682040. You can also call us on 984-706-4668. You can also email us on drvpgangadharan@gmail.com. Today, we discussed about breast cancer. In the forthcoming episodes, there will be more light shed on the hidden sides of cancer. So keep watching Patient Education series on cancer. Eat healthy, be aware and live a safe and healthy life. क्योंकि हमें आपकी फिक्र है.